Welcome back to the Al Nathan Show. Vice Silker Joe Show, co-host Joe here with y'all today. Thanks for sticking with us through this hour of the program. And we are joined for this last segment of the hour by Lynn Barr. She is founder of Caravan Health. Lynn Barr, appreciate you joining us today. How are you?
I'm good. Joe, how are you today?
I'm doing well, thank you. So the Trump administration, this past Monday, they have allocated $50 billion to rural areas to help kind of, as Dr. Oz put it, right-size the system. I mean, I find it kind of weird that $50 billion is used to, quote, right-size something when usually right-sizing means you're cutting a lot of stuff. What's going on with this?
Right. Well, it is true that sometimes you have to spend money to make money. And the idea behind this initiative is to really change how we're delivering care and focus on health, wellness, nutrition, exercise, and chronic disease management, as opposed to paying providers for removing more legs because of diabetes. Let's prevent diabetes. And that's where the savings will come from.
Okay. Stitch in time saves nine, pretty much is the idea behind this investment.
That's right. I mean, as a nation, our average cost per person is roughly $15,000 a year in the United States. And the average of other developed nations is $5,000 a year. So, we've got a bunch of waste, fraud, abuse, and really poor management of health. And so this is really an effort to really bring down the cost of care and not just let it continue to rise because it's killing Americans. I mean, the whole thing with the subsidies of $1,500 a person, I mean, who cares when we're overpaying by $10,000 a person? And that's $3 trillion a year that we're overspending on health care right now. So I think what the administration is trying to do is say, let's get out there and change the system.
Right, and they're starting with these rural areas, these areas that are generally underserved communities, as opposed to starting in, say, major cities.
Well, it's funny. I've done Caravan Health did transformation in hundreds of rural hospitals across the country and thousands of clinics. And this is the best place to do transformation because you can get everybody around the table. Everybody knows everyone. Everyone knows what's going on with other people, and they can all get around the table and say, yeah, we're going to do this. So when I started organizing the rural communities, they saved Medicare $500 million in 8 years, and they got half of that money back through a program called the Shared Savings Program. So that's the whole idea. I mean, let's make them sustainable by reducing the cost of care. So it's sort of on my model that we showed that this could be done. And now I'm excited for them to be expanding it to other rural areas. But, urban needs to pay attention to what they're doing, because they're actually doing the right thing out there. Yeah,
definitely needs to be made to more sustainable and affordable models of healthcare. Just because you have insurance doesn't mean that healthcare is affordable. I think it's something like 75% of bankruptcies due to medical coverage or due to medical needs are people who have already been insured.
That's right. And isn't that ridiculous? It's the number one cause of bankruptcy in the United States is you can't pay for your healthcare bills. What I mean? It's, even if you are insured, like you said, 3/4 of them are insured, but between the co-pays, the deductibles, the costs are out of control. And there's ways to fix it. And I'm really excited about how the Republicans are looking at this and saying, let's look at it differently, because we've all been saying the same thing, and every year the costs go up. So we're approaching 18% of GDP this year, right, in healthcare costs, 18%. And it's projected by 2033 to go over 20%. One in every $5 we produce is going to be spent on health care. So it doesn't need to be that way. It could be 1 in 10, and we could put all that money back in the pockets of the taxpayers, and we could take better care of the beneficiaries, because even though we're the most expensive in the world, our outcomes are about 40th. And our life expectancy is like 5 years worse. Our maternal death rates are like third world countries, So the system is broken, and, hats off to the Republicans in rural America for trying to make it better.
Yeah, because, just throwing money at the problem, that seems to be what we've been doing since Obamacare came out. That seemed to have just been, let's throw money at the health insurance companies and hope somehow costs improve, which clearly has not been the case.
Well, what's really funny? Somebody made this joke to me the other day. It's only in America that you would believe that you would put the government up against private equity and capitalism, and the government would win. Right?
Yeah, definitely not. In the lead up to the government shutdown last year that was in part over healthcare coverage and continuing the Obamacare subsidies, we saw the insurance companies had spent $400 billion on lobbying. And from the subsidy extension, they got $1 trillion. So they're willing to spend 40% of that on lobbying.
Oh, yeah. Did you know that the most profitable healthcare plan in the United States from an insurer's point of view is Medicare?
No wonder that we see this claim that we need Medicare for all at this point, because that's just the most profitable.
Oh, absolutely. And, I'm on the Medicare Payment Advisory Commission. We advise Congress on payment policy. We discovered a few years ago that we were overpaying these guys by hundreds of billions of dollars. And, wow, you should have seen the attacks. I mean, you gotta keep that quiet, I mean, we don't want anybody talking about that. This is the best care people could get. And I'm like, I don't think so. It's the most expensive, for sure.
This anecdote that I bring up anytime this topic comes up, it's from 2013 or 2014. My grandmother had a brief stay in not a hospital, but the therapy place, and they gave her an aspirin. And it was like on the bill, it showed $69 for an aspirin. That aspirin is not worth 1,000 times more than the pill you buy at the grocery store.
Exactly. Well, so you bring up a really, really important point. So I think maybe it was 5 years ago. I can't even remember how long it's been. The government said, okay, we need price transparency because here it is, almost 20% of our GDP. And people are buying it, and they don't know what it costs, and they don't know what the value is. They don't know what the quality is. They just get told later. So all the hospitals, everybody needs to tell you what things cost.
Well, Lynn Barr, appreciate you being on the Al Nathan Show.
Thank you so much.